Teething can be a challenging time for both you and your baby. When it comes to teething, every baby is different. Your little one will likely get their first tooth somewhere during their first year of life. In this video, we will explore common signs and symptoms that might indicate your baby is teething, the typical order in which teeth appear, and provide you with some helpful tips for managing teething discomfort. The first sign of teething is often the baby becoming fussy. Some babies are born with their first teeth, but most begin teething around 6 months of age. It's important to note that some babies might start teething earlier, even before 4 months, while others may not get their first tooth until after 12 months. Some common symptoms include red, sore gums where the tooth is coming through, a mild fever below 38 degrees Celsius, one flushed cheek, or even a rash on the face. Your baby may also start rubbing their ear or drooling more than usual. Another common symptom is your baby gnawing or chewing on things constantly, which provides relief for their sore gums. They might also be more fretful than usual, or you might notice they aren't sleeping as well as before. While it can be tough to see your baby going through this, teething is a completely normal developmental process. However, if any symptoms seem concerning or if you're uncertain about your baby's discomfort, it's always a good idea to consult with your healthcare provider to make sure everything is on track. Now let's look at the general order in which your baby's teeth typically appear. The first teeth to come through are usually the bottom front teeth, or incisors, which tend to emerge around 5 to 7 months. These are often followed by the top front teeth, which come through around 6 to 8 months. The first molars, which are the back teeth, generally appear between 12 and 16 months. But remember, every baby is different. There's no hard rule about which teeth come through when. By the time your baby is around 2 or 3 years old, they'll likely have all of their baby teeth in place. Now let's talk about some ways you can help soothe your baby during this time and make teething a little easier for both of you. One of the most popular options is teething rings. These provide your baby with something safe to chew on, which can help ease the discomfort. Some teething rings can be cooled in the fridge to provide extra relief. Just make sure to follow the manufacturer's instructions for chilling, and never place the teething ring in the freezer, as it could potentially harm your baby's gums. Also, avoid tying the teething ring around your baby's neck, as this poses a choking hazard. There are a variety of teething rings and toys available on the market, and you may need to try a few to find out which one your baby likes best. Feel free to share any personal suggestions in the comments section, as your experiences may help other parents, caregivers, and moms navigating the teething stage. When your baby starts teething, they might chew on their fingers' toys or whatever they can grab. For babies around 6 months or older, you could consider giving them healthy options to chew on, such as raw fruit and vegetables. Soft fruits like melon can also be soothing for sore gums. Another option is to give your baby a crust of bread, but always supervise them to ensure they don't choke. It's important to avoid giving your baby rusks, as most brands contain sugar. Teething gels are another option, but it's worth noting that there is limited evidence proving their effectiveness. For this reason, I recommend trying non-medicated options like teething rings first. If you do decide to use a teething gel, be sure to choose one specifically made for babies, as regular oral pain relief gels are not suitable for infants. Always consult your pharmacist or healthcare provider before using teething gels to ensure they are safe for your baby. If your baby is in considerable pain, you might want to consider giving them a mild pain reliever like paracetamol or ibuprofen. These are generally safe for babies 3 months and older, but always follow the correct dosage guidelines. Remember, children under 16 should never be given aspirin, and it's always best to consult with a health professional if you're unsure. Sometimes, the best remedy is simply offering comfort. Playing with your baby or distracting them from their discomfort can help. Gently rubbing their gums with a clean finger may also provide some relief. A technique I've found helpful is to soak a clean cloth in cold water, place it in the freezer for a couple of minutes, and then let your baby chew on it. Additionally, if your baby is drooling more than usual, wiping their face can prevent a rash from forming. Once your baby's teeth start coming through, it's important to register them with a dentist. You should also begin brushing your baby's teeth with a small amount of fluoride toothpaste as soon as the first tooth appears. This will help establish good dental hygiene early on. For more information, check out the links in the description box. If you have any tips or experiences that could help other parents, please feel free to share them in the comments. Teething can be a challenging time, but with the right tools and knowledge, you can make the process smoother for both you and your baby. Thanks for watching, and until next time, take care.